Hey, welcome, welcome. My name is Dr. DeLon Canterbury. I am a board certified geriatric pharmacist and the founder of Geriatrics. Today, we're going to dive into the power of pharmacogenetics, right? Sounds like a big word, I know, but really, we're talking about how your body, your DNA, and how that can affect certain medications that you may be taking. And so, traditionally, we may be wondering, hey, if I scrape my knee or if you scrape your knee, we give everyone the same medication. Now, the future of medication, which has been growing like wildfire in the US, is the power of precision medicine and personalized care. No longer are we sticking to this one size fits all model. Now, with just a simple new innovation in a cheek swab and some AI, we can figure out which medications would actually be harmful without you taking a single pill. So, if you didn't know, I am a geriatric pharmacist. I am also known as the de-prescribing pharmacist. But a part of my de-prescribing toolkit is getting a genetic test done for all of my patients that are eligible. This is where I enter the power of the NowPatient app, which is a private service being rolled out in the UK to provide you with that type of vital information and take that headache from your provider with that trial and error approach and just throwing meds at you and hoping that it works. So let's talk about it. What is pharmacogenetics? Essentially, it's the combination of the words pharmacy and genes. That's it. And that sounds good to me. And that's why pharmacists are so giddy about this in the US. We are looking for ways to reduce preventable side effects by getting a simple cheek swab, non invasive, for a test that can last you essentially a lifetime and can tell us some vital information so you're not over here failing a medication for 6 months and then switching to another or having really tough side effects upon your first week of taking a medication. I cannot express how much I have used pharmacogenetics or genetic testing in my practice to figure out why people are failing certain pain medications or certain antidepressants or even certain blood thinners that are common to prevent heart attack, stroke, or even any hospitalizations. So let's dive into why this matters. Truthfully, I got my own pharmacogenetics test done, and guess what? What the NowPatient app provides gives clarity on which certain medications just simply won't work for me. So, using that same approach and technology, I'm able to figure out why I have failed certain medications in the past. And now, my doctor, if they want to prescribe something else, can use this report and avoid that headache of failing something over and over again. And of course, now I have my trust and I'm feeling better because now the medication is working. Because we're more precise with how we're prescribing. So let's talk about this, right? Certain medications in the body are going to be cleared either by our liver or by our kidneys. Today, we're talking specifically about two very important liver pathways that clear medications. I'm talking about CYP2C19 and CYP2D6. You may be wondering what those numbers and letters mean. Don't really worry about it, but think of it like this. Think of these pathways as, say, a road, right? If you're on a highway or a freeway, you're going to get to your destination faster, right? If you're on a dirt road walking barefoot, you're probably going to get to your destination slower. And so this is what I use to describe how certain people respond to drugs. And the drugs are essentially the cars using that freeway or dirt road. Now, we all, although we're 99% the same as human beings, there's that 1% that dictates how we may respond, and it makes us all different, particularly in how we respond to medications, right? That is what we're going to dive into today. You see, one person may do great on one drug, but another person may fail it completely and have some really, really bad side effects. That is what we're here to avoid with the NowPatient app. And that's how you, the patient, can take away some tremendous life-saving value with this awesome new service. So think of medications almost as I say, the three little bears with Goldilocks, right? You know, this one is a little too unsturdy, this one is not there for me, and this one is just right. And that's kind of how we respond with medications. Some people can really, really break down drugs extremely well. And so, using our example earlier, they're using that highway with the Lamborghini, right? Some people can't break down drugs really well. And so they may be characterized as, say, someone who can poorly break down meds. So they're basically on a bike on a dirt road, rocky path. Okay? Much, much slower. And so think of the drugs as essentially using some of these roads or highways as being a poor responder or say a ultra rapid responder. This is how we may have differences in particular medications. The panel that NowPatient offers is testing for 2C19, again, that liver pathway I mentioned, and CYP2D6, two extremely critical pathways in our livers that break down 30% of every prescription, okay? So that's quite a significant number. But that 1% of difference between all of us can tell us whether that liver enzyme is that Lamborghini or that bike, for example. So knowing that, we have ways of showing some amazing new benefits when people get this type of test. So you may be wondering, right? Am I eligible? How can I get on board with this? Using the patented services from NowPatient, we're able to use AI to figure out, one, hey, based on your medication profile, which medications are you on that would actually be worth checking a genetic test for? Secondly, to qualify, we also want to know if you maybe have had any issues with that medication. Were there any side effects? Were you feeling maybe the same as you were before? Or, you didn't respond? Or maybe it's just simply causing some fatal reactions that we definitely don't want you to have happen again. Having that type of history, plus knowing your medication list, can qualify you to sign up for this awesome service. So in the NowPatient app, we're looking for ways to figure out, well, how can this help you? Let's talk about that. The first thing that's most important for me as a pharmacist and anyone as a clinician is we want to reduce unnecessary and preventable harm. That's the number one thing here. We are trying to stop adverse events from happening by checking people's body, their DNA. That's how we respond to medications. So number one thing is reducing unnecessary and preventable side effects. That's what can happen to you when we get more precise in how we're choosing the right medications, okay? That's the power of precision medicine. So firstly, you're gonna get reduced side effects. Secondly, we're gonna know, hey, because your liver is, say, a poor metabolizer for this certain drug, we can now choose another drug from a different class, and so we have better outcomes. We have better safety. We got a patient who's happy because, hey, it's actually working. So you may be wondering, which classes of drugs matter here? We're talking mainly about with these type of pathways with CYP2D6 and CYP2C19, we're talking about medications like common antidepressants, like say Cymbalta or sertraline or Clozaril, for example. There are also antipsychotic medications that fall under these categories and how they may be cleared, along with certain blood pressure medications or heart failure medications, such as beta blockers. Another class that may be relevant are opioids. I cannot tell you how many of my patients I've been able to test with this and figure out why they've had such a bad reaction to codeine or they had such a terrible reaction to hydrocodone. This is so important when it comes to pain management. And for me, as a prescribing pharmacist and as a geriatric pharmacist, I don't have the time to put 70-year-old women at risk when it comes to choosing or guiding them along the right prescriptions. So, knowing these type of critical information is going to help the provider not only choose the best drug for you, but it's going to help you, the patient, avoid an unnecessary hospital visit or an unnecessary fatal side effect. That is my goal. And that's everyone's goal, right? It's a win-win-win. Additionally, the tests last a lifelong time. It's non-invasive. Once we find out if you're eligible for that NowPatient genetic testing service, you're able to pay privately. Right now, it's still private pay, but we're hoping this will get rolled out into the NHS health system. But once that happens, we're able to genetically test you by getting one simple cheek swab. That's right. Non-invasive, no blood, no needle sticks. It's literally delivered straight to your home. You take a cheek swab, you put it back and send it back to the lab, and you get results in only 3 to 7 days. Pretty quick. So once you have that information and sent to the lab is going to reach out to you. And then we're going to have our trained genetic specialists with the NowPatient platform talk to you about what do these, reports mean for me. This has changed the way that the medications may be used going forward. So they had their own awesome people trained in this. And again, this test lasts a complete lifetime. Yes, you take it once, but this report is going to last you forever. It's not one of those just snapshots. Your genes are your genes unless you become a mutant later in your life, right? So going into this, we're looking at a specialist who's now going to see the report and say, hey, based on your report and your medication profiles, you may want to consider XYZ. And so we're able to give you, the patient, a way to advocate to get better care. That's the whole goal. The best part about this is with that report, you're able to have a printable download that you can take right to your provider's office, and the provider can make that clinical decision with you to get off that med if need be, or switch to a better one that may work best for you. So I mentioned that they're only specifically for now, and it may change later, testing for CYP2C19 and 2D6. They make up, again, about 30% of all prescriptions. And guys, there is a lot of variability from me to you, people of different ethnicities, different origins, and how people respond to this. A good example, for instance, is with enzyme 2C19. About 3 to 6% of people of European or African origin may have a change in, maybe say being a poor metabolizer, right? Or poor way to break down that drug. But did you know that people of actually Asian ancestry or Pacific Islander have a high 13 to 23% risk of being poor, of breaking down drugs that are going through CYP2C19? One common example of that is a commonly seen blood thinner called Plavix or clopidogrel. This was a huge issue. In fact, I've had my own patients have this very same marker. My own client who was given a certain prescription was put on clopidogrel. However, he did not have a genetic test. And unfortunately, that medication was meant to prevent a stroke. He ended up having another stroke not even 2 or 3 weeks after starting the medication. And yes, this was at a well-reputed hospital system. So one may wonder, what was wrong? We did everything right. No, we didn't. We didn't genetically test him or use a service like NowPatient. And so this patient actually was a poor responder. Basically, he was on a dirt path with a bike and a flat tire, okay? Meaning that he was not getting the drug in its true active form for it to prevent the clots and to prevent that recurrent event. What does that mean? It means he ended up right back in the hospital and almost died for something that honestly could have been prevented. So that's the type of impact that you would see in using a service like NowPatient, for example, here with clopidogrel or Plavix. Now, that might be just one class of medications, but there is a slew of classes of drugs that this panel is going to help really unearth some of the unknown we don't know about. Okay, for example, medications commonly that are used by these pathways are proton pump inhibitors, okay, like omeprazole. We have anti-seizure medications. We have medications like, again, like I said, blood thinners, along with anti-malarial drugs, and also anxiety and depression drugs. So you may wonder, what can I do knowing the results of my exam? Well, we can get that peace of mind and clarity so you aren't going and just unfortunately falling victim to the traditional trial and error approach. Let's talk about depression, for example. People on average with anxiety and depression, people don't even usually respond with that first prescription they're given. About 25% of people even achieve any type of remission or resolution of their symptoms with just starting one drug. So on average, people who may have anxiety, depression, like myself, have to try 3 different agents before they find the right one on average just to get that care. This is why NowPatient is so critical. We can use a platform where in 3 to 7 days, we can figure out exactly which medications would work better for you based on your body. And then instead of you wasting 6-9 months going back and forth, trying this, trying that, throwing a pin at the wall and seeing what sticks, we can know straight up what the answer is and go with that from there. So pharmacogenetics or genetic testing is brilliant. It is running like wildfire here in the US, and frankly, I only see it being the standard of care going into the next decade, all right? So the results are completely confidential. It's going to be completely secure, and so all your information is safe. It's sent to a lab based out of Germany. They're using the proper protocols and procedures to make sure that your information isn't being leaked or sold or anything like that. And honestly, it ends up helping providers learn more how to be cognizant of what they write for without, again, just knee-jerk hoping that it works best for you. So genetic testing is not going away. The NowPatient portal is going to be a huge godsend, and it's going to help save millions of lives in the future. We are already doing this here in the US, and I could see this, again, scaling across the entire world. Everyone has a different background. Everyone has different genes. Now, mind you, a lot of it's the same, but that 1% is not. So knowing this, you may be wondering, what is in this for me, right? Improved drug response, less side effects, less mortality, less morbidity, right? Improved quality of life, better patient trust and care, provider satisfaction, and you're not using that health system, going to the ER because of a preventable medication error, right? We don't want harm. No one wants harm. We want you at home, happy and enjoying life. So with that, there's going to be increased and enhanced safety for you. And like I mentioned before, no more trial and error. Why keep trying to hope that it works when we can figure it out in advance for a minimal fee, right? So as mentioned, I am Dr. DeLon Canterbury. I am a huge advocate of pharmacogenetics or genomic testing to figure out what the medications are doing. I foresee this being a huge tool moving forward, and now we're going to see a shift from the old way of giving medicine so that you can get that best out of your healthcare. I'm Dr. DeLon Canterbury. I am a certified geriatric pharmacist, a D-prescribing pharmacist, and I am a genetic testing counselor and pharmacist as well. Check out the NowPatient app and learn more today.